Hi. As I reflect on my third anniversary here at the hospital, I started on March 2nd, 2020. And my first kind of thought process was the excitement of being in a new city, working in a new hospital. And then the pandemic struck. And then we were, all hands on deck, making sure that as caregivers, we were supporting our community. We know that with the patients that we serve, significant number of patients that are unhoused or patients that are coming from multi-generational homes, multi-generational families, that the pandemic really was a heartache for us as a community. But one of the things that I'm very proud of is the ability that we had to really serve our patients. We worked really closely looking at evidence-based practice. We worked together as a team to ensure that we provided the best quality care. We've reached out to our colleagues across the United States to understand kind of what they had gone through the pandemic and what can we do differently. And then we were supported by the downtown community. They provided us with food, they provided us with supplies. Our donors were very helpful in helping us to get the right equipment here at the hospital to be able to serve our patients. And then as I reflect on during that period of time, for us, it continues to be an opportunity for us to continue to serve our community. We are very grateful for the fact that even through the pandemic, we've been able to achieve success as an organization. We've maintained our primary stroke status. We continue to provide great trauma services. We've received recognition related to our consumer loyalty. We've received recognition in terms of the affirmative care that we provide to our LGBTQIA patients. And with all that, we've also are thinking about the future. We've been working the last 3 years on getting our new patient care tower ready. And we're excited that that's going to be opening up at the end of this year. We're excited about the opportunity to expand services in our community. I love the work that we do outside of the walls of the hospital, right? I always talk about the fact that the holistic care that we provide is important because it only not shows how important it is to serve patients within the walls of the hospital, but even more important that they need that assistance and those services outside of the hospital. And so the work that we do at Hope Street, the work that we do through our community benefits is a way that we're able to outreach to the community and continue to serve our community. And for me, I'm excited because I feel that the future is so bright. One of the things that I'm proud of and my why is related to health equity. That to me is an extremely important part of the work that we do every day. We really wear our mission as part of who we are. It's not something that's just written on the wall. It's something that we really value and something that we strive for. And so the work that each of our caregivers does to make sure that we provide an opening environment, a welcoming environment to all of our patients, to our community, is what continues to drive me. And I know that each of my caregivers, I want to thank them for all the work that they do, the sacrifices that they've made throughout these 3 years. It started off, with that bright, exciting feeling. And I continue to have that each and every day because I know that we're striving to provide the best quality care for our patients. So I thank you. And I look forward to many years of continuing to celebrate the wonderful work that we do here at the hospital.